Hello everybody. Welcome to today's live stream. We are such an honor to invite our Germany partners, PME Familienservices, with us today. And then they are one of the most experienced, leading, promising, and then EAP vendors, what we call them, employees mental health or family support vendors in Germany. And then I think today's webinar, I would say live stream, is very meaningful because it's a really good time that we can exchange our different views, how we operate EAP services in different country, right? I think it's very good good time for our Chinese audience or Chinese clients to know how EAP operates in or developed in Germany. And then because right now we have a lot of companies that have branches in Germany, in Europe. They're very curious about how EAP deliver there, and then how their people can be supported mentally, how their mental health can be well taken care of in Germany. So it's just a great opportunity for both of us. And then I think it's also a great opportunity to tell PME more about how we deliver our EAP and how we developed our EAP in China
and how we build the EAP industry.
How we build EAP industry, because we are the very first few step into this EAP field, and then probably one of the very first EAP company.
Not one of the first.
Not one of. So we are the first EAP companies, and then so it's just great for how we can better support employees across different countries. So I will leave the first few moments to PME, and then let them introduce how EAP operates in their country. So
thank you so much, Heidi. Thank you so much, Tao. Thank you so much for having us.
Time to introduce you guys. Or one is Maren, and then another one is Freddy, and then they're all from business team, and then we have been emailing a lot, and then it's a great opportunity to know more about PME, and then to know more about Germany EAP field.
Yeah, thank you so much, Heidi. Thank you so much, Tao. Thank you so much for having us. And I think it's a great opportunity to share our approaches. And I think we have a common starting point, because PME definitely was the founding idea of EAPs in Germany. And I think we are on a level playing field in this regard. Just some brief words about us. I'm Freddy. I'm with PME and in the industry now for 9 years. These days I'm taking care of international corporations a lot, and of our customer success management team. I'm based in Düsseldorf, at the very western part of Germany. Yeah, and I'm very glad to be here. Maren, I hand over to you, and you can say some words about this.
Yes, thank you, Freddy. Yeah, my name is Maren. I also work with PME. I've been with PME for 1 year. Before I did my master's degree in health psychology, and I also worked in HR. So I also have looked on mental health from different perspectives, from HR perspective, and also from the side of a psychologist. So that's why EAP is really interesting for me. And I'm based in Berlin, so in the capital of Germany. And yeah, I'm also taking care of our business customers all around Berlin and the east of Germany. Yes.
Thank you so much, Maren. Maybe just to start off, as this is a live stream, I think it's very important to have some kind of interactions. So if there should be questions arising, please always feel free to interrupt us and to go in with all your questions, and just ask us whatever you want to learn about basically the German market.
About that. If I have a question.
Just interrupt us, Heidi, every time. Feel free to. We presented quite some slides. We will try to keep it short and comprehensive and easy to digest. But I think first of all, to give you a bit of an overview of an idea of the PME story, we became a very trusted partner for companies and employees across Germany. How did that happen? As you can see on the slide, we're having EAP experience for more than 30 years now. And so basically starting off the EAP industry in Germany, it's quite an interesting starting point. And I will give you a short introduction how that happened. In 1992 in Munich, our founder called Gisela Erler, she founded the PME. And that was basically back then already in commission by BMW, the large German automotive brand who used to sell loads of cars to China, and we no longer do, and we are struggling a lot with that. So please go again and buy our cars. That will help the German economy a lot. It's a tough point for German industry at the moment. But Gisela Erler back then used to design a childcare model for the BMW workforce. So she was inspired by the US models of childcare and referral systems, and BMW asked her to try to adopt to the German workforce and to the German markets. And then afterwards, quite quickly, the demand proved the right idea. And some major employers such as Mercedes-Benz, Lufthansa, Commerzbank, or Bosch, many of them you can still find as our clients on our website. They adopted the service, and so we did expand our network to the major German cities. And this is how we expanded our branch network. And now we are based in 80 plus locations throughout Germany. So a very large network of our offices. Yeah. And just very recently in May, our founder's son, Daniel Erler, he took over the CEO position. So that's important for us. So we are staying a truly family-run business, and that's part of our identity. And as you can read on the slides, at the moment, we are currently having plus 2,300 employees, which is a very large number of employees. Very
large number of EAP company, right? So
Yeah. Many of them are working in our childcare centers.
Are you guys the largest EAP company? I mean, in the world, I think so, right? Yeah.
No, I think some American or Canadian companies
also
are larger.
Around 1,000, but you guys are like more than 2,000. So I mean,
but you have to bear in mind that our employees, they are split in between our childcare centers and our EAP branch. So in the EAP offices, it's around 800 colleagues working there. And it's still a very high number of colleagues in our EAP offices. But the majority of our fully employed staff works in our childcare centers. But it shows our hands-on approach. We rather work with fully employed own staff than using freelancers. And Maren, I'll take over to you for next slide.
Yes. So before we have a look at the topics we're talking about in our EAP sessions, I wanted to show you our customer journey. So how does the customer get in touch with us, how he can reach us in case of need. And as you can see, we have so many different options how to contact us. So by phone, by a service hotline, through contact phones, or we can also use chat. We also have an app called Maren where people can reach us. And we try to have like a really multi-channel, easy use approach on this so that everyone can use it. Because not everybody was working from a desk. We have clients in different industry. Some people work on desk, but other people have night shifts or on the field service. For them, it's maybe an app or calling easier. For other people, it's an email easier. So we try to be as broad as possible so everyone can reach us really easily. And yes, for really urgent topics, we also have our expert line. So you can call the expert line 24/7 the whole year through, and you can immediately have can talk to one of our coaches, our experts. So you can have a consultation on the phone in every moment. So yes, we try to really everybody should get in touch really easily and really fast. That's our goal.
Okay. Yeah. So I think we really adopt the same like operations on that as well. We have like 724 hotline. And then like this is mainly like two. So we really depend on two methods to reserve appointment. One is hotline, another one is like platform. But I think but you seem to have like a much more different like methods to reach out to you. That's great. I think
Yeah.
By now there are culture, right? So like what methods like your people are using, and then like
by far there are 40 to 45% of the appointment of counseling is
taken
is by the app.
Yeah, like platform. We have like
All right, guys.
That's rising in Germany.
Yeah, sorry for the interrupt because there's comments come up here.
Common questions. Yeah, common questions in Chinese. We'll translate.
Yeah, there's the audience said that she heard that the Medicare is free in Germany, and psychological counseling is
also very popular.
So
what is the mainstream format of like is that EAP is the mainstream format for taking psychological service?
Yeah, EAP the mainstream, or some other ways
they can have they can get the support, like psychological support.
You or me?
Yeah.
First of all, is the Medicare free in Germany?
Yes. So like we have like health insurance in Germany, and it's mandatory to be part of like to have a health insurance. So in this case, it's free. So I don't pay if I need to go to the doctor, but everybody pays every month. So as long as you have a job, you have to pay part of your salary to this insurance. So you pay for it, but you don't feel it. And if you're in need, you always get your help. You never have to think about, I need money to go to the doctor. It's always going to be covered. So that's a really comfortable thing, I think, about Germany, that you don't have to think about it. When it comes to psychology, like psychology help, if you have really a serious need, so in kind of disease, like mental disease, not just an issue, it has to be really diagnosed by a doctor, then the health company, the health insurance also pays for your therapist and the therapist session. But if you're just, I don't want to say small, but struggling, or you're not have a disease, but you're just having a really hard time, then this insurance doesn't cover the consultation. And that's where EAP is perfect for, to help these people. And sometimes it's good to get help before it gets that big of a problem that it's a disease. So in case of, if you think about prevention, EAP is there for prevention. And then the health insurance is paying when prevention's already too late and you have like a real disease or disorder.
100%. Plus, I'd like to add, in Germany's situation at the moment is that you have very long waiting lists for therapists. So it's very tough to get an appointment with a psychologist or a therapist. So that's where EAP comes into play as well. So we have the 24/7 immediate access to our professionals, to our clinicians, taking over for the consultations. And that's something the public system at the moment is really struggling with in Germany. So yeah, it's a
situation with the US. Yeah.
Oh, same situation like the US.
Yeah.
Maybe.
I think in China, if you have like disease or like diagnosis, like you also go to hospital. That is also covered by insurance, right? I think if that. No. Okay. I thought it was covered by insurance, but yeah.
Okay, maybe let's move on a bit more about the services we are offering, because in our philosophy we developed ourselves as an all-in-one provider, and that was basically guided by all the different stages of life employees are running through. So our product development, it always used to be very hands-on. And focused on the customer demand. So, for example, back in the days in 1998, 2008 it was, we opened Europe's first backup childcare center for flexible emergency childcare. And that was launched together with the Commerzbank. So we always try to focus on the customer's demand, and then we develop our products alongside with our customers together. That's why we added elder care services and home care services to our EAP support with for employees with caregiving responsibilities. And this way, PME was basically transitioning its way from a childcare provider to an all-in-one EAP provider, serving all stages of life. And this is basically why workplace health and occupational health and mental health and EAP basically in Germany, they are always very closely related to an holistic approach of health basically in Germany. So this shaped the whole EAP market in Germany. And even now, competition is on the rise, and there are some new competitors entering the market. But all these new EAPs, and sooner or later, they have to adopt, and they have to focus on childcare and elder care services as well. So that's I think a very special thing about the German EAP market, childcare and elder care being important points of EAP services.
I think childcare is also quite important in our EAP services as well. For our issues like family emotion, or we call family emotion will be our very first important issues, like the largest issues among all the issues that we provide. And then I think we're still seeing a growing number of concerns around child education, children education, because China is before we are one child policy, but now people are able to have more than just one child, but they were raised by one child, so that comes along with a lot of parenting issues. So
but we only provide the counseling level services. I'm not sure what kind of services you provide for child care and elder care. Are you really help them to seeking some sort of the kindergarten or something like that?
Sources, referral.
Is that covered by insurance company or
no? The insurance companies they don't have any role in the childcare system. The childcare system is very much founded by the state. But in addition, we do cover, I'm going to slide on that later on, we do cover all kinds of childcare services, like private ones, like when you're searching for a nanny, for example. We are really doing the research and referral work to find a nanny, for example. And we do run our own childcare centers, as well as offering emergency childcare. So that's very hands-on childcare services we are offering. Yeah. I think that's a different
that's a very different
all.
Chinese.
That's a different approach to most EAPs. Absolutely.
So you guys are really
comprehensive.
Help try to resolve some real problems.
Yeah, some real problems. Yeah. I mean, we're also solving the real problems.
Emotional problems.
Aside from emotional problem, there are more of resources problem. That's great.
Yeah. Right. Correct. Maren, please go ahead and tell us something about our life coaching.
Yeah. So life coaching is the typical EAP topic. Can you go on the next slide?
Yeah, sure. Sorry.
Oh. Yeah. So I think this is one of our biggest topics, life coaching. And we work with over, I think now it's 60 coaches. They all work full-time for us, so no freelancer. That's how we can guarantee the quality of our consultations. And all our coaches are trained in the systemic solution-focused counseling. That means we try to find a solution for your problem, and we support you step by step. So you can have multiple sessions, and it's always a one-on-one session. And like we already talked about, therapists, we have a lack of therapists here in Germany. So people have to wait for months or weeks, months to get a free spot. So we also help by the search for a therapist. And we support the client during these weeks. They have to wait to find an available therapist. So these are also things we do. Yes.
Or work with people who already have the diagnoses, right?
Yes. Yes. So this is the difference between a therapist and a coach. So the therapist works with people who are sick and have a diagnosis, and a coach in counseling is with people who don't have a diagnosis, sometimes don't have a diagnosis yet. And so this is also the difference in their education qualification between a coach and a therapist.
Between coaching and counseling.
So like in Germany, counseling and coaching is the same. We don't have this strict difference, I would say.
Yeah.
In Germany, it's more the difference between someone who is a therapist who needs to have like a master degree in psychology and an extra education as a therapist. So it's a really long, they study for 10 years to become a psychologist and to be a therapist. And as a coach, you also need a university degree and you need your education, for example, a systemic solution focused education, but it's not that long of a study. So, and that's the difference, because the coaches only work with people who are not diagnosed yet, and the therapists work with diagnosed people.
Yeah, definitely. In EAP, for us, there's never any kind of medication involved. So that's always out of the EAP scope.
So
is it popular for the clients to go into the coach to seek for some help, like on quit smoking or diet or
like
something health management like that? Is it popular, or what the percentage of
what kind of like person will like join in this thing? It's like, is that for everybody, or is it more for like somebody who has like abuse for like alcohol, or like for a specific group?
No, you can definitely approach it with basically every topic you want to. Yeah, definitely. And all
just look like somebody
covered as well.
Okay.
Yeah,
and it's very common.
Here on this side, we have a really broad range of topics. So I think like stress is a really typical topic, but also addiction, budget counseling, problems at work, problems in private life, in your relationship, divorce, legal advice, addiction. Like there's no off topic. So we don't try to see mental health as narrow thing. It's everything about a whole person. So everything that can happen in your life, we try to support you. So yes. Whatever your problem is, you can come to us.
Your coach also that kind of they need to get a certificate from the ICF or association like that, the International Coach Federation or something like that.
Or it's more of like your country association.
Our counselors, they do have official degrees and certification. Definitely.
Okay, yeah.
And we do have the DIN ISO certification for our counseling as well. So yeah, that's definitely regulated and to the highest quality standards.
Okay. Great.
And then our team members, they get different additional educational backgrounds, for example, in income and budget counseling.
Oh, that's great. Oh.
Okay.
Yes. Yeah. Part of life coaching is the health coaching. So yes, so that's also part of life, of course. But we have like a specific team who cares about the health coaching because they need the special education for that. And yeah, we want to help employees to build long-term healthy habits so that they stay healthy. For example, in terms of nutrition, weight management, or exercise, how exercise can help you to release stress. Also sleep and recovery. So every third person in Germany has problems with sleeping. It's a big issue. So we try to see these trends and help. And our newest topic is hormonal health, because more and more people start to talk about it. And
know about that.
Female health is really popular right now. And yeah, we try to see trends like that and see, okay, what can we offer our clients yes, to this topic. So yeah, it's really, we try to get everything from a person.
Yeah. I thought there were not that much work stress in Germany. Why would so many people have sleeping problems?
Yeah.
The stress level is quite high these days.
Maybe people have a different stress, right?
Yeah, and work stress level is quite high as well too. I think it started basically around the pandemic, around COVID times, and back then or since then, basically situation didn't really get better, and our economy is doing worse since then. Some people are having issues getting back into work life, and it's not an easy situation in the EU at the moment. So yeah, I think that's somehow mirrored in the health data as well. Yeah, that's right.
People may have stress these days. Yeah.
Well, they will be sleeping well if they come into China after overtime hours.
Yeah.
I mean, we definitely, you're right. Regarding labor legislation, we should be okay. However, it's still you get used to your circumstances, and then at the point, people, they would start to argue about having like normal shifts. And these days, actually, our current government is rather focusing on trying to make the people work more and become less sick or report less sick. So times are a bit changing in Germany at the moment.
Yes.
Becoming a bit more strict again.
Yes. I think that's a reason of a lot of people are stressed, because it's right now a lot of things are changing, the society is changing, and this stressed people. Like it's nothing like they used to have it before, and then it's the work stress, and the person is stressed, and also the stress you see everywhere in our society. So it's like a multi-factor why people are stressed.
That's correct. And I think at the same time, it's large parts of our labor force, they are in this sandwich situation where they have to care about their children and about the elderlies. That brings us to our next topics. I will try to keep these short. And I think I'm in the same situation, basically. My kids are 4 and 7, and I have to take care of my dad as well, who's 76, and he's no longer doing that good. So you're always in a bit of this struggle situation, like, okay, you have to be at the daycare center on time. At the same time, my dad is ringing the phone and he's a bit confused. And so you have to care about different situations at the same time, which sometimes make work life even a bit more stressful and more complex. And back to EAPs. So basically what we offer for parents and what we try to navigate our clients through is like with very practical help, finding emergency care, finding au pairs, finding personal or private childcare solutions, finding tutoring. We do offer backup care, daycare in our centers, in our childcare centers. And plus, we try to counsel the people through pregnancy, parental leave. We get very, very employee-friendly legislation around parental leave. At the same time, that creates a bit of difficult situation for women getting back into the job, getting back into the right position. Most of the times it's a bit a step out of the career when they leave work for sometimes longer than a year. But yeah, that's changing a lot at the moment in Germany as well. And we always try to adopt to very popular new topics. For example, at the moment, there's a lot of counseling related to ADHD in our parental counseling. Yeah, it's quite a trending topic in Germany at the moment. How about China? Is ADHD focused topic as well?
Like a diagnosis from like hospital. I don't think, but I think for children the ADHD is a diagnosis, but I don't think like adult ADHD is but people talk them a lot, but it's not still, I don't think, yeah.
Well, it's more and more popular in China. It's a big problem. Yeah, many kids are suffering from ADHD
or
and by far we have not quite a good way to cure it. So what we can do is just take care of it or just change the environment a little bit for them when they are in school or in kindergarten, something like that. Yeah.
And especially like Chinese like study environment like for kids is very competent and they're like, yeah, ADHD can be a huge issue for a whole family actually.
Yeah, that's similar. Basically,
把上面那个露出来
social networks.
右上露出来 右上
Sorry.
Should I go ahead?
Yeah, please go ahead. I'm sorry.
And at the same time, of course, Germany's systems are always complex. And that's always a business opportunity for EAPs at the same time as well. So our educational system that basically reflects our structure of having federal states. So we have 16 federal states within Germany, and our childcare system is bound to federal legislation, so not to national government. But this results in a patchwork of different daycare hours, different school systems, different holiday calendars. So it's a mess, basically. And sometimes people are living very close by in different cities, but they are divided by a state border. So they have different legislation, very much depending on where they are living. And so that's an EAP opportunity once again. And we are taking these regional aspects into account and try to deliver hands-on service for research and referring to the right form of assistance for each EAP case in this regard.
You're going to pay for that, like daycare providers to pay for that and wrapped up in EAP?
Yeah. Our clients, they are paying for the counseling and for the research and referral. But then, for example, when someone is hiring a caregiving person in their private homes, for the hours in the home, the employees are paying for themselves.
What you do is provide reference or information about the appropriate daycare providers to the client? Or
yes, but it depends on we really refer and we research private daycare providers, for example, as well. So in our database, there are loads of institutional providers for childcare, but at the same time, in our database, we research and we refer to private solutions as well. For example, in au pair services or in emergency care, in the household services.
You're not going to send someone just really to take care of those kids. Are you?
We do.
Yeah. You do?
We do. But then the hours in the private household, they have to be covered by the employees themselves.
I see why you have 2,000 plus
employees.
Yeah. That's huge business, I think.
It is.
You call that an EAP?
That is very comprehensive, right?
You also call this still like EAP? It's common?
We call this EAP as well.
Well, is it common for clients to put those stuff in EAP in Germany?
It is quite common in Germany, yes.
Wow.
Absolutely.
Wow.
It's basically based in our roots, yeah. Absolutely. And I think childcare market situation at the moment is it's relaxing a bit because our birth rate is going down. For the past 20 years, our birth rate wasn't high, but in 2025, we reached 1.3 per 1,000.
I know, right?
So yeah, it's quite low. So that relaxes a bit the situation in the childcare market, in the institutional childcare market. But at the same time, the recruitment of caregivers becomes more and more complex. So we are really struggling finding a good labor force, finding good caregivers in our own childcare centers. It's not easy at the moment because yeah, different factors. It's quite stressful jobs. It's not that well paid, but it becomes better paid. Education is difficult. So yeah, that's the situation our childcare market is in at the moment. Yeah, and having demographics in mind, let's maybe move on to the different side of the story, to the elderlies. And yeah, number of old people is rising in Germany, and number of people who need care, who need elder care, it rose to 5 million in 2021. So it's quite a high number of people who need elder care by now. And then at the same time, of course, once again, German care system is very complex and federally different as well. So once again, for us, quite a business model as an EAP to come in and offer elder care services. Our elder care system, the care system, is embedded in the social insurance model. So that always is interrelated. So there's the structure of care, health, pension, unemployment, accident insurance, which are all compulsory in Germany. So very complex system in total to understand. And the employers, they co-finance this welfare state system. So that's different from other states. So it's always the employees plus the employers funding this system. And it becomes more basically, it becomes more expensive each and every year. So that's another challenge Germany is facing at the moment. So what we do and what our counselors in EAP do is they try to navigate the people through all these systems of the different types of insurances, of the different types of medical assessments. There are different types of care levels, and you're eligible to different funding depending on your care levels. So we do basically offer guidance in this very complex system.
Been doing there is pretty much like the social workers job.
Yeah.
I think.
Yeah.
I was wondering, the majority of your employees, their background are they psychologists or therapists or social workers or?
It depends. You're absolutely right. Yeah, you're absolutely right. Within childcare and in elder care, loads of our staff members, they have education in social work, for example, or social studies, social sciences. And in our EAP field, what Maren presented before, most of our staff members, they have a degree in psychology. And so, yeah, definitely the education of our staff members differs depending on the area they're working in. Yeah. I will cut this one short. Like only important to emphasize, once again, we're really offering hands-on service with our own certified so because there's specific German occupational
Yes. So yeah, we also offer services, and if you go on the next slide, we offer the company interface planning. So in Germany, by German law, it's the duty for a company to follow up this kind of support if an employee has been sick more than 6 weeks in a row, or like single days, but a total sick in a year. So if someone is sick for that long time, the company has to offer them a company duration management. So for the company, it's mandatory, but for the employee, it's voluntary. So the employee can say, yes, I want to join that or no, and it's not allowed so that they have a negative, like that their job is negative affected by that if they do it or not.
Oh.
And this is where PME tries to help the companies, because this can be really complex process. And sometimes it's good if someone from external, like some external partner, is helping the employee to get back in their job. So the goal is to provide the employee a healthy environment for their job, so they can stay healthy and don't get sick again. So that's the goal. And we support with introductory workshops for the employees, but also for the managers. So, for example, how to handle employees with chronic diseases. We also do individual case management where we talk to the employees. So what do you need to stay healthy in your work environment? Or what do you need for a healthy work environment? And we also do coordination and moderation of discussions. So sometimes there's a conflict within a team. So we also try to solve this conflict with the team. And also there we have our coaches who are sometimes this high experts. So they are really quite big high process. So maybe this is different than the Chinese laws, that the law only says you have to take care of your sick employees. I don't know, maybe how is it in China?
Sick employees, actually, like, employees on leave is not a big issue in China, right? Like, would you say that?
Yeah, I don't think there's the same law yet. Only sick leave.
Sick leave.
And covered by the insurance, is for sure, yeah.
Yes, it's covered by the insurance here too, but sometimes the work environment is a reason why someone gets sick. So it doesn't matter if the person maybe like have a broken leg and is sick for 6 weeks, or they have, for example, depression or burnout and is sick. Doesn't matter why the person is sick, the company has to take care that they're getting back into their work and have a good and healthy work environment.
And that's actually that's a growing field of us. We're supporting more and more companies in this field because it's quite tough for them to manage the cases themselves. So that's really a large business opportunity for us. Yeah.
Okay, then.
Similar laws. If someone say that it is the working environment that gets you sick, would be that's.
It's definitely not an easy area to work in, because sometimes, well, if you're, for example, working in a factory, there are different circumstances one simply cannot change. I mean, when you're a factory worker, that's basically it. You have
in factory, the labor protection is another story, like the harmful chemistry or light or a big noise, something like that. That's for sure. Yeah, that's called labor protection, I think.
Yeah, when we go to the next slide, we see something like another process, which is by law in Germany, and it's a psychology risk assessment. So we have risk assessment for physical health, like it's the same, I think, in labor security, but we have the same for psychological risks. So that's by law. So the company has to do this risk assessment and ask for stress risk or like everything that comes to mental health with the companies. So we support them during this process, and especially because it's by law, companies have to do this, and it can be really costs a lot of time to do this. So we try to support the customers here. So we try to find out what the company needs. We look for the risky factors, and try to develop actions against it and also bring them to action. We have to see if the actions are working. Did it work? Does the employees feel better? And of course, we do the whole documentation, and we support them through a long time. So it's really can take sometimes for years to do this whole process.
Risk assessment
in Germany, because I know in the US it is very hard to conduct
like assessment or screening, like you're able to.
But in China it's popular.
Yes,
I was wondering how is it popular, normal in Germany?
Because
the companies have to do it, but most of the companies don't do it. So a couple of years ago, the government introduced a fine for companies who are not doing this assessment. And even there's a fine, still especially small companies don't do that. And but this shows like the physical risk assessment, they take it really seriously. Every company is doing it, and the government is really checking on this. But for the psychology risk assessment, some just don't do it. Now they introduced a fine, but even with this fine, they don't do it because some saying like, okay, I rather pay the fine before putting so much work in this assessment, because I think that's the problem underneath. They don't take like mental health that serious as physical health.
Yeah, and at the same time, I think our state lacks a bit the capacities to really monitor if the companies are acting according to this rule, and it's not that well monitored or supervised at the moment.
Yeah, so
and basically this process it goes on. It should go on forever. That's quite a challenge for smaller companies.
Yeah, and also the law says you have to do it, but they don't say how often. So some company does it one time, and the next time 15 years later, where everything has already changed, because it's not like this precise in the law. That's a little bit a lack there.
It's a bit weird.
Yeah.
Sorry. Sorry. Pardon?
Yeah, is there any like concerns around this? Like they feel like they're being invaded by their
personal information is going to be
invaded,
or
and like their privacy will be touched by.
Or they don't want their leaders to know their like, psychological status.
Is that a big issue as well?
Taking part in the assessment is voluntary, right? No.
There's a specific amount of numbers of employees who have to take part of it, a percentage. I don't know exactly what. So they have to be part of it. But the question they ask are not that private. It's anonymously, so you don't have to say your name. And they don't ask private question. It's more like, do you feel stressed at work? Do you feel you get enough breaks? Stuff like that. So I think like privacy is here not a problem.
All right, we changed to some advertisement. I think we can cut this one short as well, but just to show you what we are offering as well.
We have our digital health day. So in Germany, it's also really common that companies organize a health day in their companies, so the employees can get information about health. And of course, we want to do that for our clients. And that's why we created the Digital Health Day. So we invite speakers, as you can see there. You probably don't know them, but in Germany, they're well known. Doctors, comedians, like professionals. And they do we do this live stream and the participants can ask questions. We also have a health week with small challenges around that. And for us, it's just a communication tool to get to be more known in the companies, so the employees know us at the PME, and if in case of need, they know that they can reach us. And yeah, it's just I think it's a fun and low pressure way to advertise ourselves a little bit.
Yeah, absolutely. And we started this in times of COVID, and it wasn't very, very popular back then to have like a digital format. And we continued, and this year we even made it a whole week. And it's usually around the World Mental Health Day. So this, the 10th of October, I think it is. Yeah, it's a nice offering of us. Yeah, maybe to wrap it up, some cultural perspectives. First of all, we talked a lot about Germany because talking about the EU is a different story. It's 27 countries in the EU, all of them having the national legislations, and offering services within Europe is not easy as well. We are having several partners in Europe to cover EAP throughout Europe. But yeah, Germany being the strongest economy and largest market in Europe, at least so far. So yeah, talking about the whole EU, it's a different story. That's a point I wanted to emphasize. And talking about cultural perspectives on EAP, like the struggles we're having at the moment, very high rate of average sick leave days, 15.2 days per employee per year. Quite a high number. Yeah, we have a high number of long-term absence, 5.8% of the total workforce being absent for a long time. Yeah, so that's I think the struggles we're in at the moment.
Yes. And we can also have a look at the causes of the sick leave. So 25 to 35% are things like back pain, joint pains. And then on the second place, it's already mental health with 15 to 25% is because of mental health. And 10 to 15% is respiratory infections, like when people get the cold, get the flu. So you can see like mental health is a big issue here when you look on sick days, and especially when you looked on longer sick days. So in mental health cases, the leave is 30 to 33 days per case. So that's why EAP or support in mental health is really, really important. Yeah, that the people stay healthy and that the workforce is there. And also 40 to 45% of disability pension are because of mental health disorders. So yeah, it's a big problem. And as you can see in the graphic in the right corner, you see it's really increasing. So especially we see since 2021, so since the pandemic, the mental health issues are increasing and the sick days are increasing. So I think there are more than one factor because why this is happening. But yeah, it's concerning.
Absolutely. And regarding the EAPs for us, there's still, it got better, but there's still a stigma around mental health. Definitely. It's still there. I think it got a bit better recently. Then special thing about the EU and especially about Germany, always the focus on privacy, focus on data security, data protection, confidentiality. That's quite a tough cookie to handle in Germany. And yeah, that makes things sometimes a bit more complicated. For example, the usage of AI. Yeah, Germans always, yeah.
Of a stigma. I also have a data to share with you.
Okay. Let's go.
Well, we did.
We reached the end. It's not that much time left, but we're done from our side, but we are happy to continue the conversation at a later point for sure. That was nice to.
Yeah.
We did the slides, and you can share the slides with your
audience. Okay.
Okay, yeah. So you can share.
Because we did a survey in a very big supply chain, many factories. We did survey for those blue collar workers about mental health literacy. Here's the data we got that it's a very interesting contradiction. That's over 70% of respondents agreed that depression is a clinical mental illness. Over 70%, they agree depression is a real illness. But at the same time, a majority part of the employees believe that mental health struggles are a sign of personal weakness or a lack of willpower. So that's a very interesting contradiction here. So there's still a long way to go to get more people come to normalize the EAP or counseling stuff like that. Although in China it is a big progress. 20 years ago when we did this, or when we go to the client on site, we need to find a room to provide counseling services in the very corner, just nobody can see when you walk in. And now it just
it's like
we can do it anywhere, just nobody cares. And especially the young men are very very open to get kind of service like that, especially in those big internet companies.
Big internet company, and then
I think that's a big progress.
And this is a big progress. I think asking for help in our culture is still kind of like showing your weakness. I think it's also rooted in our culture as well. But yeah, I think thank you for sharing. I think I didn't expect that long time.
Yeah, it's good interaction.
Because I feel
no need for us to maybe next time.
And the question just pops up naturally, and I was like, yeah, but I think, but thank you for taking your time to share about like your views. And then I can see like a lot of like audience. Our audience are still growing, and then like
by far there are over 10,000.
Over 10,000, over 10,000,
and then
like, they know more about you guys. And,
maybe they are expecting you to give some short suggestions for Chinese companies to go to Europe market. What should they be? What should they do for employee care?
Even though that Europeans, or especially Germans, we are always a bit reluctant about, for example, AI. I think we can learn a lot from the Chinese approach. Like you are really very much hands-on and always at the first row in trying to push new technology. So I think we should be happy with more Chinese companies entering the European and the German market, because we can learn a lot from your approach regarding technology for sure. And
AI
is developing quite fast in China. Maybe we will be replaced the next time. You won't see us again.
Hopefully not. Hopefully we will stay human beings and we talk to human beings. But maybe at the same time, what China can maybe learn from Germany or from the European perspective is that I think it has to be, everything has to be in balance, and it's about the work-life balance. So let's try to focus on that.
I think so, talking about AI, we can share a little bit about like our like new developed AI products. I would like to share a little bit about it. You can share screen. Yeah, and so
still got time?
Yeah,
just a little bit.
Just a little bit. Yeah, just a little bit. I know I'm running out of time, but I'm still like to share a little bit. So. Still couldn't see the screen. Okay, so I think briefly say about it. So, okay. So page. This is our like newest product. Is like talking about. So, a lot of like AI is really popular. I think like every workplace is. I don't know.
Can you see this slide?
Can I see this pages? Yeah, you can see it. Okay. So like I think AI is quite. Like we have a lot of like I do say 50% of like our company are like very rely on AI. So like some internet company they already incorporate an AI agent within their system, so they just use it daily. And then right now what we were doing is like we put so we incorporate AI agent in EAP agent into that AI agent. So when that like employees naturally pops up some like concerns around like I'm not feeling well, I'm feeling burnt out, and then like or like they just disclose some like they have like sleeping problems, and then like our resources will be jumped out. Because like they really use that AI daily in their workplace, right? But if they just disclose some like things naturally that their concerns, like our resources will be popped out. And then I think that works as a function of like triage, and then like to make sure that they're like triage, like to know like to send the right resources to them, like for example counseling or articles or and then another thing is like if they really reported some suicidal like thoughts or some like ideation around like hurting others, like our AI tools will be identified and then like let our backstage know about it, and then like backstage are tracking that crisis, and then like to make sure they're okay. So and another, but we would like to emphasize is they are reaching a closed loop, because these data will be lasting on the website, will be lasting on the AI, and the next time when we trying to promote like EAP services, we have data, we know what their focus, right? Perhaps sleeping problem is what we've observing within this group, and then we know what to promote, and then what activities, what resources can be better help this company. So it's reaching a closed loop right now. And then so we will like share a little bit about like how we incorporate AI in our.
And many clients are already using dialogue robot.
Dialogue robot,
to
it's very
talk
popular.
about their emotional distress or make appointment with counselors, because the robot will give a better reference for what kind of counselors he can make appointments. So there's a lot of application scenarios we have been trying to apply AI in our platform. That's what we've been doing right now.
So these are very like our newest products. So but we have a lot of thank you for sharing a lot today, and then like you can know more about but it's not thank you. I still feel very appreciated like for your participation to this like webinar. And then I think I learned a lot about like I really see a big difference between China and like Germany market. Perhaps you don't see it because you don't see like we presenting, but I think for me it's really like how to say, like very shocking about like
that's why we should do this exchange more often.
Definitely. Let's continue.
Hope we got the opportunity to have you guys sitting here shoulder by shoulder.
If you guys would China, so like but next time if you would like, I can share you like our slides and then like our presentation later after this meeting, and then to let you guys know more about us. But I think it's a totally different operation. I would say it's like you guys are more, I think you guys are more focused on the hardware, right? Like what services could we really bring to our clients, like to the employees. But I think we are like trying to be more efficient about our service, what can be delivered probably by AI or other things. And then like we're just trying to make our sessions short, or like, I think our service is more around like efficiency. This is like our productivity. I think this is where Chinese culture thing is like, but I think I think it's more of a different culture. So But right now, I know you guys are
I think,
pretty.
Heidi, it's same for us. We are struggling, or we are working on AI integration at the moment into our EAP service delivery as well. For example, we didn't use any kind of top-down approach, but participation within PME. So basically, all of our employees, like all of them, they are eligible to use a data-safe AI. So we are really trying to make the most out of AI at the moment as well. And for example, for intakes or for legal advice, for the first steps, we're using AI already as well. So I think in our mindset, you guys and us, we are not that different. I think it's a good match.
Yeah, the AI is for sure. Yeah. All right. I think that we are running out of time today, and there are 13,000
So 13,000
audiences just hopped in, and I think
see this
you guys just deliver a very fantastic presentation to the audiences. Yeah, really,
Thank you so
really
much.
hope we can do this later again.
To talk in depth and about like what's the real differences and then like what's the different focuses.
Yeah.
And then
Definitely. And thank you so much for everyone.
Thank you.
Thank you.
Thank you very much. Yeah. Have a wonderful. Yeah. Have a good day. Have a good day.
And then
enjoy your weekend. Thank you so much.
Thank you. Thank you very much.
You have a good rest of the day. Thank you.